What's the one thing that isn't in the replacement bill that could be to best address the issue or concern that you spoke about this morning?
The part that I think, just in terms of this panel, that I think we haven't focused on yet, that was a big focus of the ACA, was affordability. It was really part of the three-legged stool, and we still have the guaranteed issue. We've moved to continuous coverage. Instead of the individual mandate, try to get people into the risk pool. But affordability is one of those three legs, and so I think moving to tax credits from the tax subsidy, which is really completely titrated to this concept of affordability, is going to leave that issue kind of not fully addressed. And I think the one place where this CBO score that is still, kind of they're chugging away, that, kind of we haven't really touched on is how all this set of incentives, when you put it all together, is really going to what's the delta going to be in terms of the number of people uninsured. And I think that it's that affordability piece that has probably been beyond anything else has kept people from having insurance. But of course, there's a lot of moving parts. It's affording what type of insurance. What insurance are you buying? You're buying this high deductible plan that might not be that useful if you don't have the cost sharing subsidized, or you're buying a plan that is now really focused on your catastrophic events rather than paying for the things that maybe are more present in your life, might be some chronic management or other elements of care. So, all these pieces fit together. But I think the issue of affordability and the movement away from titrating the subsidy for income is going to be important. And I just want to point out that it's the older individuals who typically have higher healthcare needs who are going to get lower subsidies. Plus, if we move from a 3-to-1 age band to a 5-to-1 age band, there's going to be a double hit on those that tend to be older and those that tend to live in higher cost areas. And I think those are places where we've seen challenges with the number of uninsured to begin with, and this will just increase that challenge. On the other hand, by making it cheaper and more affordable for the young and healthy, there's just more of them. Fortunately, there are more healthy people than there are sick people, so we could have greater numbers that kind of are prompted into the system that wouldn't otherwise be there. Plus, what's going to happen to premiums? They may be driven down as a result of stabilization and as a result of the fact that the sicker are going to be, the older, I guess, which are correlated with the sicker, might not enter because they can't afford it. Well, that is better. We might be able to cover more people because it's lower income, but it's not better because maybe what the purpose of this plan, the purpose of these reforms should be to try to address the needs of those elderly, the people that are, I guess I'm tending towards that elderly group, right, 50 and over, that are going to start to have chronic needs that would otherwise be uncovered. So, we're kind of moving away from this affordability issue, particularly for those that may have the greatest needs in care, to kind of focus on other parts of this elephant. I just thought that was an important thing to bring up.